Asthma and chronic obstructive pulmonary disease, or COPD, are two common respiratory conditions that affect millions worldwide. These conditions can significantly impact quality of life, making breathing difficult and triggering a host of other symptoms. While they share some similarities, understanding their distinct characteristics is crucial for effective management and treatment. Asthma is characterized by inflammation and narrowing of the airways, which carry air to and from the lungs. This narrowing restricts airflow, leading to symptoms like wheezing, coughing, shortness of breath, and chest tightness. These episodes, known as asthma attacks, can range from mild to life-threatening. COPD, on the other hand, is a progressive lung disease that makes it increasingly difficult to breathe. It encompasses conditions like emphysema and chronic bronchitis. Emphysema damages the air sacs in the lungs, while chronic bronchitis causes inflammation and mucus buildup in the airways. Over time, COPD can severely limit airflow, making everyday activities challenging. Understanding the differences and similarities between asthma and COPD is crucial for proper diagnosis and treatment. While there is no cure for either condition, effective management strategies can help individuals breathe easier and live fuller lives. Both asthma and COPD present unique challenges, and recognizing their distinct characteristics is vital for proper care. In the following sections, we'll delve deeper into the causes, risk factors, management strategies, and preventive measures for both asthma and COPD, empowering you with the knowledge to breathe easier and live a healthier life. Asthma and COPD both impact the respiratory system, but they do so in different ways. Understanding these differences is essential for effective management of both conditions. In asthma, the airways, which are naturally flexible like rubber bands, become inflamed and swollen. This inflammation makes the airways hypersensitive, and when exposed to triggers like allergens or irritants, they constrict, narrowing the air passages. Imagine trying to breathe through a straw that's suddenly become much thinner. That's the sensation many people with asthma experience during an attack. COPD, conversely, causes long-term damage to the lungs and airways. The walls of the air sacs in the lungs lose their elasticity and break down, making it harder for the lungs to expand and contract properly. This process, known as emphysema, reduces the surface area available for gas exchange, making it harder to get oxygen into the bloodstream. Chronic bronchitis, another component of COPD, further complicates breathing by causing inflammation and excess mucus production in the airways, obstructing airflow. The result of these changes is a persistent feeling of breathlessness, often accompanied by wheezing, coughing, and chest tightness. These symptoms can range from mild to severe and can significantly impact an individual's ability to perform everyday activities. While both asthma and COPD can make breathing difficult, the underlying mechanisms and long-term effects differ. Recognizing these distinctions is key to developing an effective management plan tailored to the specific needs of each patient. While the exact causes of asthma remain unclear, a combination of genetic predisposition and environmental factors is thought to play a significant role. Understanding these factors is crucial for managing the condition and minimizing the risk of asthma attacks. Genetics plays a part, as individuals with a family history of asthma are more likely to develop the condition themselves. This genetic predisposition can make the airways more sensitive and prone to inflammation. However, Simply having a family history of asthma doesn't guarantee you'll develop the condition. Environmental factors also play a crucial role. Environmental triggers can vary from person to person, but common culprits include allergens, dust mites, pollen, mold, pet dander, and cockroach allergens can trigger an immune response in the airways, leading to inflammation and bronchospasm. Irritants. Tobacco smoke, air pollution, chemical fumes, and strong odours can irritate the airways, triggering asthma symptoms. Respiratory infections. Viral infections, like the common cold or flu, can inflame the airways, making individuals with asthma more susceptible to attacks. Exercise. Physical activity can trigger exercise-induced asthma in some individuals. Weather changes. Cold air, dry air, and sudden changes in temperature or humidity can trigger asthma symptoms. Stress. Emotional stress can exacerbate asthma symptoms in some individuals. Identifying and avoiding these triggers is a cornerstone of asthma management. By minimizing exposure to these triggers, individuals with asthma can reduce the frequency and severity of their symptoms and live fuller, more active lives. Section 4. Causes and Triggers. Unraveling the roots of COPD. Unlike asthma, which often develops in childhood, COPD typically affects older adults, with smoking being the primary risk factor. However, other factors such as long-term exposure to irritants and genetic predisposition can also contribute to the development of this progressive lung disease. Smoking is by far the leading cause of COPD, accounting for up to 90% of cases. Cigarette smoke contains thousands of harmful chemicals that damage the lungs and airways over time, leading to the characteristic emphysema and chronic bronchitis seen in COPD. The longer and more a person smokes, the greater their risk of developing the disease. While smoking is the primary culprit, other factors can also contribute to COPD. Long-term exposure to irritants. Prolonged exposure to dust, fumes, and chemicals in the workplace can irritate and damage the lungs, increasing the risk of COPD, especially in individuals who smoke. Genetic factors. Alpha-1 antitrypsin deficiency, a rare genetic disorder, can increase the risk of COPD, even in non-smokers. Respiratory infections. Frequent respiratory infections, particularly in childhood, may increase the risk of developing COPD later in life. Air pollution. Exposure to outdoor and indoor air pollution can damage the lungs and contribute to the development of COPD. Early diagnosis and intervention are crucial for slowing the progression of COPD. Quitting smoking, avoiding irritants, and managing other risk factors can help preserve lung function and improve quality of life. Section 5. Long-term effects, complications of asthma and COPD. Both asthma and COPD, if left unmanaged, can lead to serious long-term complications that significantly impact quality of life. Understanding these potential consequences underscores the importance of early diagnosis, effective management, and proactive preventive measures. Chronic, poorly controlled asthma can lead to airway remodeling. Persistent inflammation can cause permanent structural changes in the airways, making them less responsive to medication and increasing the risk of future attacks. Reduced lung function. Repeated asthma attacks can damage the delicate tissues of the lungs, leading to a gradual decline in lung function over time. Respiratory failure. In severe cases, asthma attacks can be life-threatening, leading to respiratory failure if not treated promptly. Similarly, COPD can progress and lead to respiratory failure. As COPD progresses, breathing becomes increasingly difficult, and the body may struggle to get enough oxygen, potentially leading to respiratory failure. Heart problems. The strain of working harder to breathe can put stress on the heart, increasing the risk of heart disease and other cardiovascular complications. Pulmonary hypertension, COPD, can cause high blood pressure in the arteries of the lungs, further stressing the heart. Frequent respiratory infections. People with COPD are more susceptible to respiratory infections, which can worsen their condition and lead to hospitalization. Managing both conditions effectively is crucial to mitigating these risks. Regular doctor's visits, medication adherence, lifestyle modifications, and prompt treatment of exacerbations can significantly improve long-term outcomes and enhance quality of life. Section 6. Breathing easy. Managing asthma. While there's no cure for asthma, effective management strategies can help control symptoms, prevent attacks, and allow individuals to live active, fulfilling lives. The key lies in a personalized approach that combines medication, trigger avoidance, and lifestyle modifications. Asthma medications fall into two main categories. Quick relief medications. These fast-acting medications, such as short-acting beta agonists, SABAs, delivered through inhalers, quickly open the airways and relieve symptoms during an asthma attack. Long-term control medications. These medications, such as inhaled corticosteroids, are taken daily to reduce airway inflammation and prevent asthma attacks from occurring in the first place. In addition to medication, identifying and avoiding asthma triggers is crucial. Allergen control. Keeping the home free of dust mites, using hypoallergenic bedding, and minimizing exposure to pet dander can significantly reduce allergen exposure. Pollution avoidance. Limiting outdoor activities on high pollution days and avoiding secondhand smoke are essential for managing asthma. Infection control, frequent hand washing, vaccination against influenza and pneumococcal pneumonia, and avoiding contact with sick individuals can help prevent respiratory infections that can trigger asthma attacks. Lifestyle modifications can also play a role. Regular exercise. While exercise can trigger asthma in some individuals, regular physical activity can strengthen the lungs and improve overall health. Working with a doctor to develop a safe exercise plan is essential. Healthy weight. Being overweight or obese can worsen asthma symptoms, so maintaining a healthy weight through diet and exercise is beneficial. Stress management. Techniques like deep breathing exercises, yoga, and meditation can help manage stress and reduce its impact on asthma symptoms. By working closely with a healthcare provider and taking a proactive approach to managing triggers, individuals with asthma can live full, active lives and minimize the impact of the condition on their daily routines.